Happy Monday out there. Start to another beautiful week. The weather is gorgeous, a little less warm than it has been. So I'm sure that lots of you are out there getting some yard work done this weekend. I'm coming to you from United Way of Chatham-Kent with our 3 p.m. chats. We're bringing you up to date on all the things that are happening in the community. Today with me, I have Linda Lucas. Linda's the executive director from the Active Lifestyle Center here in Chatham. So welcome, Linda. Thanks very much for joining me on this call.
Oh, thank you for having me.
So you must be taking the call from your office. I spoke to you a little bit earlier this morning, and you said that sort of life has been as a little bit normal for you as you're still working out from the office. But tell me, where are your staff, and how have things changed at the Lifestyle Center?
Yes, I've been working all the way through. I have a staff of approximately 11 people. They've all been laid off. The full-time staff were back for a short period in between. But I'm happy to say that the full-time staff will be back to work this week on Thursday, and we will be ramping up our COVID programs and looking at what we can do to reopen. So that's an exciting thing because this building's pretty big to be alone for any extended period of time.
Oh, I'm actually working from my home office. However, our office in Chatham is still pretty active with staff coming in and out of the building. We're pretty fortunate because we have our space allows us to physically distance ourselves. So it's certainly nice to be in touch with your coworkers. So I look forward to that for you, Linda. So we were talking a little bit earlier about the Active Lifestyle Center. Can you explain what is the center all about? And you spoke about membership, so touch on that.
Yeah, so the Active Lifestyle Center is a senior recreation center for people in Chatham over the age of 50. There are 11 senior centers in total in Chatham-Kent, but ours is basically in Chatham. We do have members from the rural areas. We offer 60 to 65 different programs ranging from arts and crafts to music, dancing, billiards. We have a full service wood shop. We offer technology. We have computer and tablet programs. We have a cafe every day that we serve lunch. So you can imagine during COVID, things have just came to a screeching halt, especially with our target of individuals being seniors and the pandemic really affecting them.
Yeah, this has definitely had a very big effect on some of our most vulnerable population and seniors, definitely. You've been joining us every Thursday morning, and for those of you who are on listening to this right now, on Thursday mornings, up to 60 nonprofits, as well as the municipality, United Way staff, are joining in on conversations with respect to specific priority populations. So, Linda, you've been sitting in on the senior table where you're discussing what the immediate needs are of seniors. Do you want to expand on what your experience has been at that table?
Oh, yeah. It's just amazing. The first half hour of the meeting has all 50 or 60 members of the table getting updates of what's going on in the municipality, with the province, how anything positive, anything negative, we get to share everything, and then we break out and I'm in the senior room, and it's just great to touch base with the others. You get funding opportunities, you get partnership opportunities, you're able to network, and then it's been really informative for me, and it's probably one of the most valuable things I do in a week now.
Well, that's good to hear. We're finding it to be a very effective use of, our time, and definitely it's just really beautiful to see everyone come together, and put the people at the center that we're trying to serve. And in your case, it would be seniors. So on that note, you had mentioned funding. So you did apply for $10,000 worth of funding. And I know that that has already been doled out. And I want to talk a little bit more about that because, you know, when you and I had spoke earlier this morning, you talked about that you were delivering through outreach comfort bags. You were also sending out greeting cards and feeding the people that are frontline serving. So let's start off with the comfort bags. What do they look like? What's in them? Where are they going? How are you getting them out? Who are you partnering with? I know there's a ton of questions, Linda,
Okay.
but you know, go ahead. Tell us all about it.
Okay. So a comfort bag, the bags, we have all kinds of community partners that are donating things first. So we have like we've had the municipality, RBC, Tech Savvy, Enbridge, different organizations come and donate bags. And then they also donate swag. There's pens. There's a company called Nurses Next Door that donated hand sanitizers. My quilting group made masks. So then the masks go in the comfort bags. So a bag would consist, there'd be a mask, there'd be hand sanitizers. There was a great booklet put out by some health professionals at the hospital, and it's 57 pages. And we actually copy that book, and it's all about COVID and living with COVID and how it's affecting our community. So we included that in the bag. We give word search. There's always a few snacks in there, maybe some playing cards or nail files. Just something to, and maybe even a greeting card, just something to let the seniors know that we're thinking of them, but also educational, and then the protection equipment for them. And the bags have gone to retirement homes. They have gone to many members. They have also gone to companies like Nurses Next Door do nursing visits, and they know which seniors are isolated. Pro Respite has visits to people who live alone as well. And then it's been a word of mouth where we've had people call and say, can we pick up some masks? Can we pick up some comfort bags? All kinds of places. I had a meeting with some of my board of directors, and all of them knew at least somebody that they thought would benefit from the bag. So, you know, it's just a great program that started small and has really grown.
Have you heard any feedback on the bags, like on any
Oh,
seniors that have received them and what they're thinking, how it's made them feel?
yeah. The biggest phone call that stuck in my mind, there was a gentleman from a long-term care home who called me, and he actually lived in the home, and he thanked me for the organization and my staff for taking the time to do this. But he said he still had all of his faculties about him. So he said he would have never had access to that information living where he was living at that capacity, and that he slept really well. His eyes were so tired because he read the whole 56 pages, and that he enjoyed the snacks. So, you know, that phone call alone was worth $1 million to me, because you don't realize that, you know, it could impact somebody. But I take daily phone calls of people. I actually had 3 this morning. We mailed out just actual greeting cards, 1,175 of them, not a comfort bag, but a greeting card. And I had 3 phone calls this morning of people just thanking me for the greeting cards. So the comfort bag, when a bunch go out, we do get at least 2 or 3 phone calls a day.
That's awesome. Before I ask you anything more about the greeting cards, I want to talk to you about the masks. You said that, do you belong to a quilting group that was making these? Is that how that started?
No, actually, we just have a lot of ladies are our members, and they got together to make the mask. But sitting at the round table on the Thursday morning meeting with the United Way, I let them know we were making masks and that we can use a lot, because we're going to be opening foot care programs and stuff later, and we like to offer anyone the mask who comes through our door. So the United Way connected me with the quilting Chatham Quilting Guild, and now every other day or a couple times a week, ladies will just stop off and drop off masks that are donated to us for us to distribute. So that's been a definite benefit and partnership.
Where are the masks being distributed besides the comfort bags? Because I know that you, again, when we spoke earlier, there was a number of masks. Like I believe, I don't know, I thought I heard you say something around 500 masks, but where are they going in the community besides the comfort bags?
Yeah, my girls alone did 500 masks, but the Quilting Guild and the ladies, they're working on thousands for us. I've donated masks to the hospital. I've donated some masks to one of the local pharmacies. We've donated masks to almost every Tim Hortons, to frontline workers, senior apartment buildings. So, and again, we've had just people call and say, oh, we heard that you have masks, and we'll put them in the mailbox, and seniors will just come to the center to pick them up.
That's fabulous. Okay, so back to the greeting cards now, because I know that the greeting cards were part of this project that came out of the needs discovery tables. Talk a little bit more about that. How are you reaching people? And I'm assuming, I thought I heard you say membership, which would include all of Chatham-Kent, correct?
Well, actually, ours, this one didn't include all of Chatham-Kent. The comfort bags did, though, because we're doing outreach to the rural communities. That's our next phase with the comfort bags. The greeting cards, we actually used our membership, and we went back because not everyone was able to renew their membership in 2020 because it was right in the middle of COVID. So we used the last 2 years of people who were members at the center, and we were able to mail out 1,175 greeting cards. So, and truly, if I run into a member in Shoppers or in the grocery store, that's the first thing they say to me. Oh, we got your card, or, oh, we got your comfort bag. So it really is something that's meaningful.
That's awesome. And it's so nice to get something in the mail besides a bill.
Yeah, that's true.
Okay, so my next question, or next thing that I'm going to ask you to talk about is you had said that you were providing some meals to frontline workers. And I'm just going to share my screen right now because I'm assuming, can you see my screen? I'm assuming that this may be a picture of, one of the activities of, providing meals to frontline workers. So maybe expand on that, Linda, like, maybe some of the, places that you've provided the meals, and maybe speak specifically about this one here at Meadow Park.
Okay. So, yes, I just want everyone to know, and this is very important for me, that everyone who showed up last Thursday was not being paid. The majority of my staff were here, and a few volunteers, and they did this out of the goodness of their heart. It was an amazing day. We fed 202 meals to 6 different retirement homes, and this one here in the picture is Meadow Park. The food was delivered by Family Service Kent, and again, that partnership came out of the roundtable discussions. They were served a full roast beef dinner with mashed potatoes, vegetables, dessert, and a beverage. We also sent comfort bags for the members, and there was bottled water that was donated by Victory Ford. And it was just an amazing event all around. Meadow Park, all the homes thanked us. It was Meadow Park. There was residents on the Thames, Eden Villa, Maple City residents. There were 6 in total, and it was really just a great day.
That's awesome. And do you have plans to continue doing this while we're in this COVID pandemic?
Well, it was kind of a one-time deal, and the funding we used, but if we are able, or there is extra funding, we would like to do something in the rural areas as well.
That's terrific. I'm sure that it put a smile on some of the staff's faces. So the other thing that we talked about, Linda, because everything's virtual nowadays, and at this time anyways. And when you had talked about all the different programs at the Active Lifestyle Center, that's not a whole lot of virtual, right? Playing pool, you have to,
Right.
well, actually they do have video games for that, but really, like, you have to be there in person. So you had talked about having a virtual exercise program. So maybe you want to expand on that, what that looks like, where people can access it, and and how that's going.
Okay, so right now, one of our volunteer instructors is Steve Botterill, and a lot of people know Steve in the senior exercise community. He does all kinds of exercise programs and shares them virtually, and Steve has been kind enough to share them with us. There's probably 12 or 14 different exercises, as well as we've expanded to have Steve start to tape our own instructors. And those are all shared on the ALC website, the Active Lifestyle Center Facebook, and the ALC Friends group. The website is actually going to be revamped in the next week and a half so that the virtual exercises are more predominant and easier for seniors to find. But I would say there's probably 20 different programs, including our instructors, that are targeted just towards seniors, and they're really great exercise programs. So we're hoping to expand that and continue that, and as well as have them shared on Cogeco TV in the near future.
That's fantastic. Is there anything, Linda, before we tie up this conversation, and I thank you for taking some time out of your afternoon, is there anything that you would like the public to know? For instance, I don't know, I feel like we're in week 256, but it's really like 10 or 11. And at the beginning, it seemed to be that a lot of community organizations really wanted the public to understand that they were there, that they're open. And, obviously that sounds like the same for you. So maybe expand on that, and anything more that, that you really want the public to know. Are you looking for volunteers? How are you open for services? How can people connect with you? You talked a little bit about your website, so we'll take a note of that, but anything more?
I think I would just like to let the members know that we are closed just for programming, but the staff will be here, and they've always known that we're here. We're here to help seniors if they need anything, to connect them with senior resources. And I do know that everyone is very concerned about foot care, and that is in the near future. We are definitely looking into foot care because it is a necessity to get that up and running. But as of now, we have no timelines on anything, but don't hesitate to call the center to speak with us or reach out if there's any needs of any seniors in the community.
Well, again, Linda, thanks really very much for joining us this afternoon. We really appreciate you taking some time out of your day. And thank you, Chatham-Kent. Please continue to join in on these calls. And, if you have any questions about some of the programming that organizations are doing, or any of the activities that are happening at United Way of Chatham-Kent, please don't hesitate to PM us. We've got people behind the scenes that are watching for any kind of questions that you may have. And as always, if you are looking for help, if you're wanting to help, and that means, volunteering, or if you want to donate, please visit www.ckgives.ca. Thank you, everyone. It's a beautiful afternoon. Thank you, Your TV, for hosting this, and please join us again on Wednesday.